Welcome, everyone. Thank you very much for joining our roundtable entitled Bridging Health Gaps, Leveraging Research to Address the Health Impacts of Climate Change, organized by the French Red Cross Foundation as part of the RT3 Long Night of Research 2025. My name is Vincent Léger. I am a research officer at the French Red Cross Foundation, and I am pleased to host this roundtable discussion today. Before we get started, a quick reminder of the rules governing online participation, interpreting, and the AI-generated translation and subtitling systems you'll be able to use. Please note that this session is being recorded. I kindly ask you not to take pictures of the screen or of other participants without permission. If you have questions or want to react, you can use the chat to type your questions during and or after the interventions. For any technical issues, just post your question in the chat and one of our administrators will assist you. This session is also being interpreted simultaneously in French, Spanish, and Arabic. To turn interpretation on, simply click on interpretation at the bottom of your screen. In addition, we are very fortunate to be living at the time where AI can facilitate our meetings and collaboration. So I invite you to use the AI-generated captions and translation feature during this session. Looking at the bottom of your screens, you will see a feature that states show captions. Click on this button, then click on the smaller row on the top right and turn on, which is the turn on translation. You can then select your speaking language as well as the caption language, which is the language in which you want to read the captions. And I hope this makes sense for you. A summary of this information is going to be posted in the chat just now. If you already know the French Red Cross Foundation, then it's a pleasure to meet you again today. If you are discovering the French Red Cross Foundation through this event, on behalf of the whole team, I would like to welcome you and thank you for your interest in our activities, which I invite you to find out more about by visiting our website, the address of which I am just giving you in the Zoom discussion chat, along with other links, which I will mention in a few moments. The French Red Cross Foundation is a recognized public utility institution committed to supporting research on humanitarian and social action carried out by researchers close to a crisis, whose findings, widely disseminated and reviewed, lead to transforming existing practices. The Foundation's vision aligns with that of the French Red Cross to advance scientific knowledge and social innovation to aid the most vulnerable people in France and throughout the world. Among all the Foundation's productions that you can find on our website, I invite you to browse through L'Essentiel Scientifique, 10 years of research going to the heart of vulnerabilities, the title of a special book we published in 2023 to mark the Foundation's 10th anniversary. This book looks back on all the work accomplished to date, almost 50 research prizes awarded, 60 articles, 50 policy briefs published, more than 50 calls for research grants launched, some 700 scientific projects received in response to these calls, of which 130 were supported to conduct research in over 20 different countries by researchers of more than 20 different nationalities and 16 different disciplines. This 10th anniversary was also an opportunity to launch new projects, such as a series of podcasts, for example, which we have called Enquête d'Humanité, and which enable you to discover the results of research work supported by the French Red Cross Foundation through the voices of those who conducted it. So you can find also the podcast on our website via the link I give you in a moment in the chat, and on all the main broadcasting platforms you can find this podcast. I'd also like to take this opportunity to remind you that all events organized by the Foundation are filmed and you can find all the videos on our YouTube channel. So thank again to all for joining our roundtable that we have chosen to dedicate to the health impacts of climate change for several reasons. Climate change represents a fundamental threat to human health worldwide. Research shows that 3.6 billion people already live in areas highly exposed to climate change, whether it's famine caused by falling agricultural yields, accident-related death or disability during cyclones, the spread of parasitic and infectious diseases, or hypothermia during heat waves. The effects of climate change on human health are multiple. According to an extensive review published by Nature Climate Change, climate hazards affect 27 attributes of human health, including mortality, morbidity, injury, malnutrition, and life expectancy. Climate change not only increases the scale, frequency, and intensity of major natural hazards, it also threatens health infrastructures and mental health, and exposes populations to greater risk of contracting fatal diseases such as malaria, cholera, and typhoid. Disasters in particular have terrible consequences for health, affecting populations directly with death, injuries, illnesses, etc., as well as the organization of societies, impacting harvests, access to water, electricity, etc., and health systems through access to emergency services, supply of medical equipment, availability of qualified personnel, and so on. However, as with all causal relationships, it is often difficult to isolate the part attributable to climate change alone. The effects of climate change are compounded by a large number of individual, social, and environmental vulnerability factors that influence each other. What's more, in many countries, the dysfunctions of structural weaknesses of healthcare systems are amplifying factors in the impacts of climate change on health. To say it differently, climate change does not create them as such. The links between climate and health are therefore complex and need to be better understood. At the crossroads between academic and operational questions, the production of knowledge on these issues is particularly necessary today, as the links between climate and health, numerous and multiform, remain poorly documented, particularly in developing countries with fragile health systems. Following its participation in the organization of the Global Conference Health and Climate Change, which took place in 2019, to coincide with the 100th anniversary of the International Federation of Red Cross and Red Crescent Societies, the French Red Cross Foundation is continuing to reflect on these issues by supporting scientific research aimed at understanding the links between climate change and health, particularly in Africa. The general aim of this research is to assess and anticipate the health impacts of climate change, the responses that can be made to them, and to strengthen advocacy in favor of reinventing humanitarian response methods and adapting healthcare systems to the upheavals underway. Particular emphasis is placed on studying the role of civil society organizations, the concrete effects of community dynamics, and the replicability of indigenous initiatives. So this roundtable is thus a continuation of initiatives already underway at the French Red Cross Foundation. It proposes to explore the effects of climate change on health, focusing on how research can help us to face, treat, and respond to some of these risks. It will highlight important, significant Red Cross, Red Crescent research initiatives carried out in Cameroon, Chad, and Nepal, and discuss how research findings and evidence can help the RCRC movement to better support people affected by climate change to lead safe, healthy, and dignified lives. So I will now introduce our guest, whom I would like to thank once again for agreeing to take part in this roundtable. So Marcus Bacaira, thank you for being with us today. You hold a PhD in Geography and Geomatics. You are a teacher and researcher attached to the Geomatics Laboratory at the University of Ngaoundéré in Cameroon. Your work focuses on the application of geospatial technologies to the management of natural risks and disasters, and more generally on the humanitarian challenges linked to environmental crisis and climate change in the ecologically fragile areas of Cameroon and Chad. In 2024, the French Red Cross Foundation awarded you with a research grant after designating you laureate of the call entitled Health and Climate Change in Africa, Indigenous Knowledge and Community Initiatives for Local Responses, supported by Foundation S, the Sanofi Collective. Thanks to this grant, you are now conducting a research entitled Community Resilience to the Health Impacts of Climate Change in the Logan Plain in Cameroon and Chad, which we'll be talking about in a moment. Before that, I put right away links to presentations of your research in French and in English in the chat. Oh. I'll do it in a moment. Ija Ormel, you are a global health researcher and humanitarian practitioner with over 20 years of experience in crisis response, health promotion and research. As senior manager at the Canadian Red Cross, you lead research and technical support for health in emergency and recovery programs worldwide, including climate change and health initiatives. Your fieldwork spans outbreaks such as cholera, Ebola, and COVID-19, and you have worked with the MSF, UNICEF, and the Danish Refugee Council. Ilya, you also hold a PhD from McGill University on participatory approaches to cholera response in Haiti. Ahmad Webi, you are a healthcare management professional with over 10 years of experience, specializing in strategic planning, quality improvement, and global health initiatives. You are currently a senior health advisor with the Canadian Red Cross, where you provide technical health programs, programming support, contribute to capacity building, and advance throughout leadership in global health. Previously, you worked with MSF also on sexual and reproductive health projects, managing infection control, compliance, referrals, and nursing teams. Ahmad, you hold a master also in healthcare management, quality and technology, postgraduate diploma in project management and humanitarian leadership, and a bachelor of science in nursing. So Ilya and Ahmad, together you contributed to a research project, which was a collaboration between the Canadian Red Cross and the Nepal Red Cross Society, and aiming at understanding how climate change is affecting both community health and the capacity of local health systems to respond on the Susta rural municipality in Nepal, a region facing increasing climate risks, including flooding and heat waves. You'll be talking about this research in a moment, but before that, I put also links to the final report and infographic in the chat. Shona Witten, you are a mental health and psychosocial support, so MHPSS, I will say, advisor at the Red Crescent Movement, MHPSS Hub, with a focus on MHPSS in emergencies, climate change, and monitoring and evaluation. You have tertiary qualifications in psychology, disaster management, humanitarian assistance, and gender policy. Prior to joining the RCRC MHPSS Hub, you worked in emergency operations with the Australian Red Cross for over 10 years, where you were responsible for field disaster recovery operations and emergency MHPSS programs. This included managing the agency's largest disaster recovery operation to date, following the 2019-2020 Australian bushfires. You also work as a consultant specializing in disaster recovery and resilience and emergency MHPSS. And finally, Georgina Grundy-Campbell, you are mental health and psychosocial support consultant. You have over 20 years of expertise as a mental health nurse, trained in the UK. You have worked extensively across different healthcare settings, low and middle income settings, and as part of humanitarian responses. You have held multiple positions as MHPSS coordinator and MHPSS technical advisor for International Medical Corps, and currently as a consultant for the World Health Organization. The focus of your work is to support efforts to strengthen health systems and services so that people living with mental health conditions are identified early and have access to quality and sustainable support. This includes supporting innovations to address the determinants of mental illness. So Shona and Georgina, you published together a paper in the journal Intervention, the Journal of Mental Health and Psychosocial Support in Conflict-Affected Areas. This paper is entitled Mental Health and Climate Change, Hot and Bothered, applying the 5 elements framework to the climate crisis, which we'll be talking about in a moment. And I'll put now the link to this article in the chat. So thank you all once again for agreeing to take part in this roundtable, which begins with you, Marcus. And for that, I'm going now to switch and to speak in French. So Marcus, en vous présentant à l'instant, j'ai dit que vous travaillez actuellement sur les résiliences communautaires face aux incidences sanitaires des changements climatiques dans la plaine du Logone, au nord du Cameroun et à l'ouest du Tchad. Alors précisément, votre terrain d'étude se situe autour des fleuves Chari et Logone, qui sont régulièrement confrontés à des crises climatiques marquées par des événements extrêmes tels que des inondations ou une sécheresse accrue. Et ces événements exposent les populations, directement ou indirectement, à des risques sanitaires importants. Cependant, les questions de santé communautaire liées aux impacts de ces changements climatiques n'ont pas encore été étudiées en profondeur dans cette région, bien qu'elles soient mentionnées dans les plans nationaux d'adaptation au changement climatique, par exemple. Et en conséquence, vous constatez un décalage, bien souvent, entre les solutions d'adaptation proposées et les besoins réels des communautés locales qui nuit finalement à l'efficacité des réponses humanitaires aux catastrophes et aux risques sanitaires qu'elles induisent. Alors, ma première question pour vous, Marcus, dans ce contexte-là très particulier, pouvez-vous nous présenter d'abord rapidement votre projet de recherche, en quoi il consiste, quels sont ses objectifs et comment vous procédez pour les atteindre dans votre terrain de recherche?
Ok, merci Vincent. Je remercie la Fondation Power Française de m'avoir associé à ces échanges qui vont me permettre de présenter les résultats ou alors de présenter mon projet de recherche portant sur les résiliences communautaires face aux incidences sanitaires des changements climatiques dans la plaine du Logone, le cas du Cameroun et du Tchad. Alors, il faut déjà dire qu'en matière d'environnement, la santé est le résultat du milieu de vie et du mode de vie. Alors, dans ce contexte, lorsque nous sommes dans un environnement où il y a une forte densité de population, où le taux de pauvreté est élevé, où l'insécurité alimentaire est marquée, à ce moment, la vulnérabilité des populations face aux aléas climatiques est de plus en plus également marquée. Alors, l'étude tente donc de répondre à la question de savoir comment convient-il de capitaliser les stratégies endogènes propres aux communautés en matière de résilience sanitaire dans un contexte de changement climatique. Alors, spécifiquement, il s'agit de savoir comment les communautés appréhendent la Alors, spécifiquement, il s'agit de savoir comment les communautés appréhendent-elles les effets des changements climatiques sur leur santé. Ensuite, l'étude cherche également à savoir quelles sont les stratégies de résilience que développent les communautés face aux incidences sanitaires des changements climatiques. Alors, l'objectif global, c'est de mettre en lumière, discuter et archiver de manière correcte le savoir endogène et les actions posées par une grande partie de la communauté au titre d'achat en réponse aux changements climatiques. Alors, pour atteindre cet objectif, disons que l'étude est basée sur une approche mixte, c'est-à-dire elle intègre à la fois les données qualitatives et les données quantitatives. Alors,
Marcus, pardon de t'interrompre. Est-ce qu'il est possible que tu te rapproches du micro? Peut-être on t'entend un petit peu de loin et pas très clairement. Voilà, je veux juste savoir si tu peux faire quelque chose pour améliorer la qualité du son.
Ok, ok. Alors, vous me suivez mieux?
Un peu mieux.
Ok, d'accord. ok, je reprends au niveau de l'objectif. Je disais que l'objectif général vise à mettre en lumière, à diffuser et archiver de manière pérenne les savoirs endogènes et les actions posées par une grande diversité de communautés au sud du lac Tchad en réponse aux effets des changements climatiques sur leur santé. Alors, pour atteindre cet objectif, nous avons mis en place une méthode mixte, c'est-à-dire basée à la fois sur des données qualitatives et des données quantitatives. Alors, l'étude se base sur des enquêtes et entretiens de terrain auprès des populations générales, également auprès des acteurs qui interviennent dans le processus de gestion des risques et catastrophes d'origine climatique. L'étude est également basée sur la cartographie participative, sur la cartographie par télédétection et également sur la modélisation des risques et catastrophes. Et enfin, l'étude prend en compte l'analyse des données biophysiques et environnementales. Alors, tout ceci se déroule dans un environnement fragile, l'écologie également fragile, où la population subit beaucoup de pauvreté, et c'est la raison qui nous a motivés à choisir ce projet de recherche. Merci.
Merci Marcus. Votre recherche est toujours en cours, hein. Vous l'avez commencé qu'en septembre et vous devez finir en fin de cette année seulement. Mais pouvez-vous néanmoins nous partager certains de vos premiers résultats, certains de vos premières préliminaires observations? Vous avez par exemple pu étudier des sites de recasement de déplacés climatiques. Qu'avez-vous observé à propos des questions sanitaires dans ces sites de recasement particulièrement?
Merci. L'étude porte sur toutes les communautés vulnérables, mais dans la plaine de Legon, bien sûr, mais les déplacés climatiques sont particulièrement ciblés par rapport au reste du monde, tout simplement parce qu'ils sont plus vulnérables en matière de risques sanitaires d'origine climatique. Alors, pour aborder les questions de santé dans les sites de recasement, il faut s'intéresser aux facteurs de vulnérabilité et la caractérisation des 10 facteurs, ou alors et la caractérisation des sites de recasement également. Alors, il faut déjà dire qu'en matière de santé et de vulnérabilité dans les sites de déplacement, de déplacés climatiques, on note premièrement l'exposition aux intempéries. Alors, cette exposition est liée tout simplement au fait que, contrairement à un site de réfugiés, par exemple, les sites de recasement des déplacés climatiques, ce sont des installations spontanées, ce sont des installations provisoires et inclusives qui n'offrent pas toutes les commodités nécessaires pouvant suffisamment limiter les effets des expositions, soit à l'hyperthermie ou également aux fortes chaleurs. Il faut deuxièmement dire que les sites de recasement des déplacés climatiques sont des zones de forte densité. L'effectif est totalement incontrôlé parce que les inondations, par exemple, peuvent affecter tout un quartier en une demi-journée. Et alors, les mesures qui sont prises sur le terrain ne permettent pas de comptabiliser ou de maîtriser les personnes déplacées pour des raisons climatiques. Donc, cette promiscuité exacerbe les risques de contamination et les risques d'infection. Il faut également dire que sur les sites de déplacés climatiques, nos observations nous ont permis de comprendre que le système d'accès à l'eau potable est faible et presque inexistant. Alors, étant donné qu'il s'agit des implantations spontanées, l'accès à l'eau potable est assez difficile, malgré les efforts faits par le pouvoir public et également par les organismes internationaux, surtout les acteurs humanitaires. Et à cela s'ajoute que, troisièmement, ou alors quatrièmement, l'assainissement. Un système d'assainissement presque inexistant également. Les populations n'ont pas de latrines, d'autres improvisent des latrines qui ne permettent pas la gestion des déchets et tout le reste qui concourt à l'hygiène et à la santé de façon saine. C'est la raison pour laquelle nous trouvons ces sites de déplacés exposés au risque de contamination. À cela également, il faut ajouter que l'accès aux soins de santé est limité, étant donné que l'effectif des personnes déplacées est incontrôlé. L'accès aux soins de santé également est insuffisant, malgré les efforts fournis. changement, nous parlons de cet accès à la santé limitée tout simplement parce que lorsque le dispositif est mis en place, étant donné que le déplacé est incontrôlé, les moyens mis sur pied s'avèrent également insuffisants. Alors, enfin, il faut également dire que les types de déplacés climatiques se caractérisent par des maladies d'ordre mental ou alors des troubles psychologiques simplement liés aux pertes des biens, liés au déplacement brusque et forcé d'un lieu à un autre. Donc, ces éléments permettent, en caractérisant ces éléments, nous relions maintenant les questions de santé à la vulnérabilité. Merci.
Merci Marcus. Vous étudiez également les maladies liées aux effets des changements climatiques. Pouvez-vous nous expliquer comment et pourquoi certaines pathologies sont liées au changement climatique et qu'est-ce que vous observez en pratique sur votre terrain de recherche?
Très bien. Alors, il faut déjà dire que les changements climatiques ne créent pas de maladies, mais ce sont les variations et les modifications des paramètres climatiques qui augmentent les risques de contamination ou d'infection. Alors, dans ce cas, il y a deux événements externes auxquels notre recherche s'intéresse. Il s'agit ici des inondations et de la sécheresse. Alors, les changements climatiques exacerbent plusieurs maladies. Premièrement, en cas d'inondation, prenons le cas des inondations, nous notons ici des maladies respiratoires telles que le paludisme, dont la cause est connue de tout le monde, mais lorsqu'il y a inondation, en fonction de l'implantation des uns et des autres, le risque d'infection ou alors le risque de propagation du paludisme est assez élevé. À cela, nous prenons maintenant le cas de l'autre événement externe qui est celui de la sécheresse. Il y a des maladies liées à la qualité de l'air, c'est-à-dire des maladies respiratoires, donc liées aux épisodes de chaleur qui favorisent la formation de l'ozone troposphérique et plusieurs autres éléments polluants qui affectent la santé des communautés, et principalement la santé respiratoire. Alors, il y a également les maladies hydriques, ou alors des maladies liées à. Nous parlons tout à l'heure du système d'assainissement et du système d'hygiène. Alors, les épidémies de choléra sont de plus en plus observées dans les sites de recadrement de la population. Et il y a également des maladies liées aux contaminations de l'eau, qui sont les diarrhées, les infections gastro-intestinales, etc. Donc, vous pouvez noter que ces cas-là, nous avons ici affaire à une panoplie de maladies qui est essentiellement accélérée ou bien qui est exacerbée par les effets de changement climatique. Alors, en matière de réponse, ou alors en matière de résilience, il faut déjà dire que les populations développent elles-mêmes des réponses communautaires, premièrement liées à leur déplacement. Elles peuvent implanter des sites de recasement que j'appelle des sites de recasement communautaire. Elles procèdent à l'automédication, elles font recours à la médecine traditionnelle, elles font recours au changement de pratique pour améliorer la sécurité alimentaire, etc. Donc, ces éléments sont à l'axe de l'utilisation durable des changements climatiques sur la santé. Je vous remercie.
Merci Marcus. Je vais arrêter là et j'aurai peut-être une dernière question, mais on est un tout petit peu pris par le temps et la qualité du son est vraiment moyenne. Donc je la garde éventuellement pour la fin de notre table ronde. Merci Marcus. Now Ilya and Ahmad, the floor is yours. So I was saying in the introduction that together you contributed to a research project which was a collaboration between the Canadian Red Cross and the Nepal Red Cross Society. It focused on the Susta rural municipality in Nepal, a region facing increasing climate risk, including flooding and heat waves. The aim of this study was to understand how climate change is affecting both community health and the capacity of local health systems to respond, using a framework developed by the WHO, the World Health Organization. The research team analyzed climate and disease trends, conducted community surveys and interviews, and assessed the vulnerability of health facilities. The findings of your research reveal clear links between climate variability and health impacts. The study not only highlights the urgent need for adaptation, but also provides practical recommendations to strengthen resilience and at the community and health system levels. So to begin, could you briefly explain us what this research project was about and what you set out to learn?
Thank you so much for your question, and also thank you for organizing this panel. And I'm really looking forward to learn more from all the other participants as well. So we are also really excited to present in the name of our team member who unfortunately couldn't be present. That's Ramesh Nupan, who was based in Nepal, working for the Canadian Red Cross. So as I said before already, this research was a collaborative effort between the Nepalese Red Cross Society, the NRCS, and the Canadian Red Cross. And we worked in coordination with the Ministry of Health and Population and also the local governments. And we, as you said as well, we aim to understand, there are like three elements, how climate change is impacting the health and the health systems in vulnerable settings. And our aim of this research was to increase resilience, improve the readiness of health systems, to continue delivering quality healthcare and services during and after the disasters. So the Canadian Red Cross has supported Nepal since the 2015 earthquake response and recovery efforts after that. And this really laid the foundation for ongoing collaboration in health system strengthening and resilience building. So we focused on one rural municipality, which is called Susta, and it's based in the low-lying region of West District, which is called Nawal Parasi. It's an area that is highly exposed to flooding, cold and heat waves, and changing rainfall patterns. This region also faces significant public health challenges, particularly in water and vector-borne diseases, respiratory infections, and limited access to healthcare services. So you can imagine that the health facilities in these areas are often impacted by floods, inundation, and heat waves, and affecting their ability to maintain their service delivery. So our study, as you mentioned, followed the WHO framework for climate resilient health systems. And we sought to look at three different data sets. So we analyzed climate trends and health data. We assessed the community level of vulnerability and adaptive capacity. And then we also examined the preparedness and resilience of local health facilities. So we aim to bring all this data together and find our recommendations and for practice. So the goal was not to only generate evidence, but also to, and that was really important for us as well, like in many of the research projects now, inform and support the implementation of practical interventions based on the research findings and recommendations. So an important part as well was to strengthen the link between climate science, what's happening, in climate science, health programming, and community resilience. So we used a different set of different research methods, as I said before. We accessed these meteorological data sets and health records. We had surveys with 207 community members. We facilitated focus group discussions with women and informal health leaders. We also carried out in-depth interviews with key informants, which included health officials, climate experts, and local leaders. And also, as a fourth part, we observed the health facilities to assess their readiness to prepare for and respond to emergencies. So that's all. Back to you, Vincent.
Thank you very much. So you carried out what's called health vulnerability and adaptation assessment. Can you tell us what that means in simple words and how useful it is for humanitarian work? Ahmad, your mic.
Yes, so I will try to do that and explain the health vulnerability and adaptation assessment, which is a structured tool that helps us understand what climate hazards are that are affecting the population and what makes them vulnerable, including the socioeconomic status, the geographic exposure, the access to services, and existing health conditions, and as well how those hazards are impacting health and how capable communities and health systems are to adapt and respond to these climate shocks. So in our case, as my colleague said, we try to collect climate data from 1980 to 2022 and focusing on precipitation and temperature trends and their association with disease outbreaks such as vector-borne diseases or illnesses and waterborne infections, as well as analyzing the health records from 2018 to 2023 from the National Health Information System and conducting community surveys and focus group to understand lived experiences and assessing for rural health facilities using WHO vulnerability and capacity checklist. So again, from multiple angles to focus on the and identify the problems. So for humanitarian actors, the health vulnerability and adaptation assessment is critical because it moves us from reaction to anticipation and preparedness, aligns with risk-informed programming, and ensures that interventions are rooted in local contexts and lived realities, especially for communities already experiencing climate-related stress. In parallel to that, we are currently developing and designing a community climate and health vulnerability assessment toolkit that will support local Red Cross teams in applying the health vulnerability adaptation assessment approaches consistently and effectively. This toolkit blends quantitative methods like the climate and disease trend analysis with the community-led approaches like the surveys, focus group discussions, and key informant interviews. This to assess people's knowledge, perception, and behavior to co-opt climate shocks. It guides users step by step through identifying the climate-sensitive diseases, assessing health facilities using readiness using the WHO checklist, and translating findings into locally informed, actionable interventions. And this toolkit, it's rather than a generic checklist. This toolkit emphasizes on participatory learning and community engagement and tailored adaptation. It enables frontline staff and local actors to link the meteorological patterns with real health outcomes, define vulnerabilities, and propose targeted resilience actions. It's from infrastructure improvement to early warnings and reporting systems. It's a hands-on resource for making climate health planning both data-driven and community-centered. Thank you.
Thank you. So it was a collaboration between the Nepal Red Cross and the Canadian Red Cross. Can you share how the partnership worked and what others might learn from it?
Yeah, thank you so much for that question as well. So this partnership was really structured around shared ownership and mutual learning. So as I said before, Canadian Red Cross was present since 2015. This specific project began in February 2024. So the Nepal Red Cross really provided that leadership on community engagement, data collection, local facilitation, but also ensuring alignment with the district level authorities. And then the Canadian Red Cross supported with the technical design, the research guidance, and aligning the work with the best international practices. So we looked at the WHO framework, we already mentioned that a few times, for climate resilient health systems, but we also looked at the Nepal's Health National Adaptation Plan, which was developed by the Ministry of Health and Population. So we involved other stakeholders as well, so like the Nepal Health Research Council, municipal officials, and local health workers. So to ensure, that's scientific rigor and contextual relevance. So we summarize it in kind of key lessons. We made 3 key ones. There were a lot of other key lessons as well, but we have to keep it short. So as we all know, I think by now localization is key. So we really appreciated that NRCS leadership, and it ensured the trust and access to communities. And this co-creation really builds capacities. So we set out to not do this extractive data collection, but looking at how we could build local analytical skills as well, building on the institutional memory that is present, and also designing and conceptualize this study to provided a huge learning curve, I think, for everybody, because it was all new for us. And then the policy alignment was also really important, because that, once we finalized the study, we realized that really increased the impact. So working and really building on the national adaptation plan from Nepal and these other local climate-informed health policies really helped us to make the findings relevant beyond in this site, but also beyond the site. So as was said as well, this boarding, it's really essential that we translate the research findings to practice. And this collaboration since the start really helped us to build on this collaboration and to share the results of the study with the Ministry of Health, the Research Council, and WHO. And we're also really happy to mention that these findings contributed to the finalization of this national adaptation plan. And also at the local level, people were really eager to learn, and it was one of the first times they were exposed to getting more knowledge about the climate change impact. And some communities were so interested to continue this study that they started gathering their own resources to be able to continue this learning process and implementing changes and improvement. So this partnership also from our side, the Canadian Red Cross has been continuing to work on this and been able to replicate these learnings in collaboration with other Red Cross partners in different countries. And of course, the tool development that Ahmed just spoke about. So we're really grateful for both the NRCS team and the CRC team for contributing to this and building that critical research expertise, as well as to Ramesh, the CRC delegate that was based in Nepal. And unfortunately, again, he couldn't be here, but he had a really central role in facilitating the collaboration with the NRCS, coordinating with the ministries, and his leadership bridged that local implementation and contributed to the research rigor in the implementation phase.
Thank you very much for talking about impacts. What are some of the clearest examples, evidences from your findings that shows how climate change is already affecting health in the communities you studied? Could you give us some of your main findings about this issue?
Yeah, as you started in the introductory, we saw clear evidence and a link between the climate change affecting health and the effect on the health across multiple dimensions. From one side, the climate and disease trends showed a clear evidence of increased temperatures in the region, Susta region, which was rising, especially the minimum temperatures. The rainfall patterns have become more erratic with more frequent extreme precipitation, and this has contributed to more flooding and waterlogging. These changes coincided with the seasonal surges of illnesses, especially the respiratory infections and waterborne diseases like diarrhea, typhoid, and cholera. At the community level findings, we found like most residents rely on subsistence farming, and many live in flood-prone or heat-exposed areas. And most of the members, over 87%, reported that the climate in their area has changed over the past 15 years. While 90% of respondents said that they could physically access health services, yet availability was often inconsistent during the extreme weather events, and the preparations were very low. As well, more than 87% reported that a low level of preparedness for future climate-related disasters, and around 75% said that they did not have an emergency plan for natural disasters. The community awareness of climate-related health risk is growing, but structured adaptation strategies are still lacking. As for the health system vulnerabilities, our assessment, as we said, for 4 health facilities, revealed several critical challenges, as none had climate resilience infrastructure like power backup, protected water sources, or emergency contingency plans, as well as preparedness or response plans. The health workforce lacked training in climate health response, and surveillance systems were very limited. In short, the climate change is already disrupting both the health outcomes and service delivery. And these findings support the case for urgent investment in climate resilience, primary healthcare systems that are at-risk communities. Thank you.
Thank you very much. And Ahmad, now Shona and Georgina, the floor is yours. So as I was saying in the introduction, you both worked for the Red Cross Red Crescent Movement MHPSS hub, one as a staff member, the other as a consultant, and you signed together, you published together a paper in Intervention, the Journal of Mental Health and Psychosocial Support in Conflict-Affected Areas, entitled Mental Health and Climate Change, Hot and Bothered, Applying the 5 Elements Framework to the Climate Crisis. This paper explores the application of the 5 essential elements of immediate and midterm mass trauma intervention developed by Stephen Hopeful, a well-known psychologist you'll talk about in a moment, to address the mental health impacts of the climate crisis. Drawing from existing literature and practical experience, your paper examines how climate change affects mental health through multiple pathways, leading to increased rates of mental health conditions and psychological distress. So before we dive into the framework of your paper, could you please explain in simple terms how climate change is affecting people's mental health, and maybe share a few examples that bring these to life?
Yes, hello, thank you. I will have a go at answering that question to start with. And again, thank you for having us here to discuss our paper, which really kind of was a thought piece because we wanted to start getting people thinking about this. So we started with a literature review. And I can't lie, the literature and the evidence coming out of the literature it's complicated, it's layered, and it's very messy. So I will try and explain it as well as I can at the moment. But I think what we definitely know for sure is, as a result of climate change, we are seeing an increase in mental health conditions. So if we think about, extreme climate events like flooding, like hurricanes, like wildfires, then what we're seeing is an increase after the event in rates of depression, in rates of anxiety, in rates of PTSD, in substance use, and in suicidality as well. But it's not just the experience, the climatic event in itself that's creating those increases in mental health. It is also what happens after the event. So how is the evacuation process handled? Is it with dignity and respect? That will affect people's kind of mental health going forward as well. How are people supported with the loss of property, loss of job opportunities, loss of home, loss of land, just losses as well in terms of loved ones? How are they supported to access education again? How are they supported to restart their social support systems that are so natural in a community? All of those things will also be impacting these rates of depression and anxiety that are happening. And so that's been quite well studied, because that's very similar to any conflict setting or disaster setting as well. But what we're also learning in the literature is about the increases in mental health that we're seeing with the increase in temperature. So we're also seeing increases in just general psychosocial unwellness, certainly in the kind of global north countries where people are just in prolonged heat, are just feeling fatigued because people aren't sleeping properly, and therefore there's cognitive problems as well that people are having. There's a kind of a drop in mood, and then in more extreme settings there have been increases in suicidality, less good outcomes for people living with mental health conditions, with more hospital admission data. So lots of different sort of data feeding into this picture. But then I think the image or the story that brings it most to life for me about the impacts of mental health is if we think about the kind of longer term, slower impacts that climate change is having as it's changing our ecology. And so people are living with through more prolonged droughts, and we're changing land use. It's not what it used to be. Biodiversity loss. So I'm going to use an example of somebody living through drought and kind of talk you through what the mental health impacts might be. So you might have, for example, a family who have lived rurally, been able to farm, produce their own food, as well as sell some of the food that they now can't do that as a result of prolonged droughts and water scarcity as well. So not being able to water the crops, not being able to live on the land, increased temperatures, meaning they're changing the times of days that they can work if it's too hot at certain times of day. So they're changing their kind of social patterns. They're changing how they can spend time together, when they can work together. They're changing the food they're eating, and we're aware that nutrition obviously is going to have a massive impact on health as well as mental health, because brain health requires good food. So and also it's going to have an impact on the adults in terms of being able to provide for their family, which can then break families down. If one parent needs to go away to find work, then you've got a female-headed household that might be left more vulnerable. So you've got kind of changes to the social way that people are living, the family setup. You've got changes at an individual level, i.e. kind of access to water is more difficult, access to nutritious food and growing it yourself is more difficult, being able to provide for yourself is more difficult. These are all big drivers of mental illness, especially common conditions like depression and anxiety. So, and then you've got to think that this is where it all gets very complicated, because then you've got to think about child and adolescent mental health as well. So again, if you've got these farming communities that aren't able to produce the food that's nutritious, then the kids aren't necessarily eating the right food at a time when they need it the most to grow. If you've got families breaking apart in search of jobs, then you might have reduced access to education, which is also going to have a huge impact on child and adolescent well-being, and especially as they grow up. We know as well that we've done some research. There's been a lot of research in terms of the heat and increases in heat, whereby there can be increases in interpersonal violence and interpersonal conflict as well. So basically, climate change, as it kind of changes the land and the ecosystems, it's also kind of changing the social systems and the social structures that are happening as well. And those are all having an impact on our mental health as we go forward. So it's messy, it's complicated, but it's happening.
Thank you. So your paper introduces the idea of using 5 essential elements to respond to the mental health impacts of climate change. Could you briefly explain what these 5 elements are and how they can help guide our work in humanitarian settings?
Sure, thank you. And just to echo Georgie, thanks so much for having us. It's I think our purpose was, as Georgie said, to kind of get some conversation going on this and highlight mental health in these types of conversations. So we're really pleased to be here. So as you mentioned in your introduction, these 5 elements were presented by Hopful and a number of other colleagues back in 2007, and they have really formed the basis of a lot of psychosocial programming in the humanitarian and development sectors for some time, or since then really, most notably through the use of psychological first aid as a way of teaching people to provide basic psychosocial support after crisis. So they were very much developed for post-crisis situations, and they are 5 sort of principles, I guess you could say, or 5 elements as the framework calls them. They are promoting safety, calm, self-efficacy, connectedness, and hope. So what these mean, and these are sort of informed by evidence, right? That shows how we do better in the long term after these types of events. So promoting a sense of safety refers to how we can assist people to feel safe in the aftermath of a threat. Calming recognizes that we have, emotional and physical reactions when we're faced with threat. So how we can support one another, but also self-regulate to deal with those emotional and physical reactions that we might have. Self and also collective efficacy is this idea that people who have agency, who can make decisions for themselves and their communities, do better in the long term. Connectedness, I think, sounds obvious. We do better with support from one another, right? We are social creatures, and lots of research says that, when we're connected with our loved ones and other forms of social support, we have better ways of coping. And that's, practical supports we can give to people, but also is important for our emotional and psychological well-being to be connected. So, for example, we hear a lot about loneliness at the moment and loneliness research. So this idea of connectedness is important all the time, but also particularly after trauma experiences or after disasters and other types of crisis. And hope it sort of recognizes that these traumatic events, disasters, they often come with this like shuttered worldview, that the things that we trusted in our communities, in our sense of safety, that this sort of makes us feel a sense of hopelessness, sometimes can come with feelings of despair. So we can it's important to counter that and maintain hope for the future. So really it's sort of, there's much research that shows if we're sort of more hopeful and optimistic, we do better in the long term. It's very simple, it sounds very simplistic, but it is very impactful. So these 5 elements have a foundation of evidence of a range of different contexts, cross-cultural as well, and they together have formed kind of psychosocial programming. And so what Georgie and I wanted to do was, we've seen these work nicely in communities in our work. We know that they inform a lot of work in the MHPSS sector in humanitarian and development contexts. And also, when we were discussing the paper, we thought, the question for us was, is there something new we need in the climate change or climate crisis context, or can we learn from existing practice that we have? So for us, as Georgie said, it was kind of a thought piece to say, well, how do this framework that we use already, that many humanitarian workers and development workers know very well, how does this apply to a different kind of context? And a researcher, both a practitioner and researcher, Patricia Watson, who was also an author on the original paper, had done a similar exercise with COVID and applied the principles to the COVID-19 pandemic. So we were also inspired by Patricia. And so in our paper, we have applied these principles to kind of practical potential responses that we could do in the face of climate change to promote these principles. So I won't go through all of them, but I'll give you an example of, promoting connectedness might be thinking about how we can connect people in communities around climate-related efforts, for example, or supporting community-led planning for disasters, building local support networks. Might also be thinking about how we can connect to nature and to the environment. Calming might also be how we use nature and green and blue spaces to make ourselves feel well or feel calm, or things like forest bathing comes to mind. This idea that being in green spaces are good for our well-being. So we have proposed in our paper a range of different things that we thought that practitioners could think about how they could embed into their work, because we know that much of what people are doing in the sector are already informed by these elements, and there's a lot of applicability, we feel.
Thank you very much. Now, maybe from theory to practice, and I know all these issues are very complicated, but maybe a question that people listening to you have in mind. But you already gave some piece of answers. What could be some simple, effective ways that humanitarian workers can help support mental well-being when responding to climate-related disasters like heat waves, floods, earthquakes, or wildfires?
Well, yes. I mean, this is what we were thinking about, and we kind of looked back on the experience of integrating mental health interventions and principles into traditional kind of humanitarian responses. And we thought, they're quite successful. There's good evidence, so we don't need to adapt too many things. We can just add to them. So I think in answer to this question, our recommendations would be applying the 5 principles, through PFA approaches, and PFA, psychological first aid, has been written and rewritten by so many different organizations in so many different ways, and it's been adapted. But it's very core. It is just saying, it's giving first responders a humane way to respond to people who have been through and are going through potentially the worst times of their life. So it's thinking about how to listen to somebody and ensure that they're listened to, that they're heard, that they're witnessed, that their suffering and their understanding of what happens is heard. It's and then it's saying, once you've heard somebody, then it's supporting them either to help with emotion regulation at its most basic, so doing very basic kind of stress management strategies, but then it's linking those people with the sectors and the services that they need. First and foremost, safety, making sure that they are safe, making sure that they have access to safe spaces, and that can be physical safe spaces as well as psychological safety as well. So having, that sense of being able to feel, relax a little bit and not be in that fight or flight moment anymore. And again, in the paper, we've suggested lots of different ways that you can do that. And then I think any good MHPSS response is layered, just like our evidence base of the impacts are very layered on a person, so are our interventions, if you like, because we like to think holistically about what you can do. So you can start with that very simple kind of humane kindness, listening approach, and then linking people up to where they need to be. And then you can take a bit of a step back and look at what is happening in the community. If you've got lots of people displaced by a fire or by flooding, like who are the carers in the community? Who cares? Can we support them to set up those caring systems that are right for that particular community? Can we find the leaders? Can we find a way to support them and resource them so that they can have some agency back, and they can feel like they're not having to be looked after, but they can take some control back, because these disasters take away our sense of control. And so feeding into that, giving them that sense of help, it's like, look at the community and say, who are the carers and how can we support them? And then for people in the community, it's also raising awareness about what mental illness is and what mental ill health looks like. It's reducing stigma around it, and it's saying it's okay to have these sort of negative emotions or distressing emotions. It's normal, in fact. So it's taking away a lot of the stigma in the community. And then for people that are in need of extra help, like people that might need more focused care, then it's looking at the healthcare systems. Do we have GPs or community health workers that are trained in understanding mental health? Do they know how to assess somebody? Do they know how to treat somebody? Do we need to train them? Are there, and then up another level. So for people with pre-existing mental health conditions, you know, is there an access to a psychiatrist so that they can get their medication if it was taken away in a flood or a fire, you know, so that specialized level of support at the top then. So it's a multi-layered approach, but it starts at the basic with using these principles that we describe in the paper in psychological first aid approach.
Thank you very much. And maybe I'll conclude with this final question, maybe more generally now and for the years to come. What do you think humanitarian organizations like the Red Cross and Red Crescent national societies could do differently or better to address mental health impacts of climate change in the future, maybe more generally now speaking?
Yeah, I think this is a great question. And I think, you know, as Georgie said, we really work in a way of sort of trying to integrate mental health and psychosocial considerations and supports across different sectors. It's very much a principle of how the sector works already. And I think we need to continue to do that, but also look beyond the kind of sectors we traditionally work with, because we need to think about climate-related programming that maybe MHPSS we're not traditionally working with. So that might be climate adaptation programs or climate justice programs, how we kind of start to think about the well-being implications of climate adaptation, or how we can also have well-being outcomes from these programs. So I think also what we need to do better related to that is understand what are the mental health and well-being outcomes of programs that are not straight MHPSS interventions, if you could understand it like that. So, you know, if it's about, for example, something to do with drought preparedness, like how does people having agency and thinking about holistic well-being also help, like how can that be part of preparedness type programs for drought, for example? So, you know, not thinking only about traditional kind of or you know, single outputs, but also thinking about holistic mental health and well-being outputs from some of these actions. I think very much there's a lot of work happening in the IFRC I know about, or in the Red Cross movement more broadly, around anticipatory action or early action related to climate change and other types of and disasters as well. And we'd really like to see considerations around mental health and well-being embedded into early action or anticipatory action protocols or planning. So, and again, how do we consider both from providing support for people, but also what the well-being related outcomes could be related to, you know, taking action before disasters happen or climate shocks happen. So I think we need to understand more about how the climate crisis will affect our health and well-being. I think we're starting to understand more, but we're also, you know, there's still a little bit this sort of like, oh, this climate change is coming, whereas we definitely know that there's many contexts where it's already here for people. So we're already perhaps a bit behind in our thinking. So, which is why, in a sense, Georgie and I wanted to look at what are we already doing that will work or has potential to work. And so I think we need more research. This is what people always say on panels like this. We need more research to understand, you know, will our existing approaches work for climate related or climate crisis related impacts? So, you know, and I think I mentioned climate justice beforehand. I think there's something really interesting to understand about how justice-based approaches can have, you know, can contribute to feelings of hopefulness in communities, of how, you know, this justice piece also contributes to us feeling more hopeful, but also we know from other types of disasters that justice is extremely important in kind of well-being, in coming to terms with our experiences. So there's also something there I think is really interesting to consider. And I think we know that health systems will be eroded by impacts of climate change. And just like with physical health, this will be an impact for mental health, difficulties in people accessing services, difficulties in services being even available to people. So I think also it's why focusing on that sort of what we call the bottom end of the wide end of the pyramid of interventions is really important. So it's about how we can continue to upskill communities and families in supporting one another and understanding about mental health impacts will be really important so that people can support each other and understand when people might need more support in the face of climate stresses, I think. So lots to do, Vincent.
I'm sure. Thank you very much, Shona. To conclude this roundtable, I'm now going to share with you the comments and questions that the public addressed to you in the chat. There are very few. There are a few, and summing them up, and I hope without betraying them, it seems that two main questions stand out. One on the usefulness of research findings for humanitarian action, and another on the conditions necessary for a national society, for example, to undertake a scientific approach in an appropriate and useful way. So the first question to all of you, you all look at the different aspects of the health impacts of climate change, from the health situation in resettlement camps to disease outbreaks induced by climate change, the readiness of local health systems to climate change, and the impact of climate change on mental health. Based on your different expertise, what is one key area you think needs urgent action to improve climate resistance in healthcare at the local level? Very broad, large question, but in a few words, maybe the question is for everybody. Maybe Georgina first.
Yeah, sure. I'd love to go first. Thank you. So, I mean, from what I've been looking at and what I've been studying, I think, you know, thinking about those 5 principles that we've talked about, thinking about agency, thinking about the resiliency that we as a world population are going to need in order to change and adapt to a climate changed world. I think what we need to do to increase resilience in healthcare at the local level is go down to the local level. I think we need to be going into the local communities, and I think we need to be talking to the local communities. I think we need more awareness in the local communities about the impacts of climate change, because they're going to be different all over the world. But, you know, as we all know, they're happening now. So I think the best thing that we can do is go down to that, you know, granular level and look into more qualitative research and get the stories coming out from what is happening. So we're not just talking about it theoretically, but we're actually seeing it, and then encouraging agency of local communities to respond.
Thank you. Ilya?
I'm afraid I might almost read. That was exactly what came to my mind as well. But yeah, I thought in the Nepal project, what I learned from the findings as well, what I found really interesting learning about was that the community was so, like, first of all, their observations and their knowledge already with the climate change. And they brought also in new elements that we hadn't considered yet designing that study. But also their eagerness to learn more and their lack of access to information. And what I said before, they really started kind of getting their own resources and engaging more and more with the researchers and the Nepalese Red Cross to even be able to learn more and be more ready for the next kind of disaster as well. So yeah, I was also thinking about the mobilization, how important that is, and being able for them to access the information, but also share their knowledge, how it impacts their lives as well. And then the second one was with regards to the healthcare systems, the facilities, to see kind of the level of preparedness and just kind of supporting them in getting more ready for the next disaster as well. So these were my kind of main thoughts.
Thank you very much. Ahmad, a word on this question?
Yeah, I would just complement what Ilya was mentioning related to the community. As she mentioned as well in one of her answers, that the community started collecting more data themselves and building up the database, so strengthening more the data systems and surveillance, improving the local health information system for real-time monitoring of climate-sensitive diseases to be more proactive in terms of any outbreak that might happen related to climate change or any disaster that would come, that they will be able to be ready and prepare.
Thank you. Shona?
Yeah, I mean, love to just, it's always nice when you agree with your panel mates. I think for me, just listening to the others, you know, this is also related to kind of a sense of agency and communities having an ability to make decisions that have an impact at a local level on their future, right? And I think something that I've thought a lot about is there is in much of kind of, I think what we understand with climate change at the moment is that some of us feel like we don't have an ability to do anything, and I think engagement in communities, in having a sense of ownership over the future of our community is so important. So this is something that sort of comes to mind, and also while I was thinking, I was just thinking about an article I read in The Guardian recently about this global research that was done on people's perceptions of the need to take climate action. And the research found that actually 89% of people who participated in the study across more than 120 countries believe that climate action is required and that their governments should be doing more. And this really counters this understanding that people who want climate action are a minority. We're actually the majority. And I think this gives me great hope that most people out there think we need to be doing more. But I think at a local level, that's also true, right? People want to do things. So therefore, how can we engage resilience to climate shocks, but then also that communities have a say in what happens at the local level and how their resources are used. So I think this is to kind of enable them to kind of stay in their communities, to stay together, because we know, as Georgie was saying, having to migrate as a result of climate impacts is going to affect social structures, culture, and really from our mental health and wellbeing point of view, really erode our health and wellbeing. So the more, I think, agency communities can have, the better. So hopefully we can get there.
Thank you very much. I'm sorry, there is a last question I really want to ask, but maybe for Ilya and Ahmad, well, because it's about how, based on your experience with your research project, what advice would you give to other Red Cross or Red Crescent societies looking to start similar research projects, such as the one you conducted? How they can be inspired by what you've done, and how can they start projects like you did in their own countries and context. I'm sorry for the other participants, but maybe based on your specific experience and for the Red Cross Red Crescent movement, can you just answer this question? We have 2 minutes left also, that's why I'm sorry, but I give the floor only to Ilya and Ahmad.
Sure, Ilya, I will just give a very like rapid answer, and I would say working closely with the local governments and the community, and this is what we're trying to do with our toolkit that we are trying to develop. It's never, as I said, a checklist to fill. Always the community needs to put their input and their knowledge, so that it will be their out of their own inspiration and contribution, and they will feel of the sense of the ownership, and it will strengthen even the results and the outcome. So just making sure that the community are involved and designing and an inclusive tool. So what we are doing with the toolkit, we give the ideas, we give the background and all what they need, and then it will be tailored by the local Red Cross society and the community.
Ilya, a final word? Or?
Yeah, well, in 30 seconds. No, I think it might, if you want to start, and there's a lot of different tools already available, and like the tool we are developing now as well, but also start small. We started quite big, and it kind of took us by surprise how much work and how much unknown there is still as well. So I think it can also, if you have less resources, start putting up these focus group discussions, visit a healthcare facility, make those observations, and then you can always grow bigger as well. But don't kind of stop by thinking, oh, this is too difficult and too complex for me. It cannot do it. You can always start in a smaller scale and then look at how you can phase it out or kind of increase the research as well.
Perfect, right on time. Thank you very much to all of you for your participation. Please let us know what you thought about this session. You can scan the QR code appearing right now with your phone to access and fill the form to tell us what you thought about this session. Thank you again to all of you. Thank you, Marcus, Shona, Ilya, Ahmad, Georgina, everybody. Thank you very much. And have a great long night of research. It's just the beginning. Bye-bye.
Bye.
Thank you so
everyone.
much. Bye.
Au revoir,
Thank you.
Marcus.
Bye.
Au revoir.
Au revoir.
Merci.